in treating pain, I've noticed too that you bring up this topic of weight loss, that this comes up very often, especially as a neurologist. People come in with the weirdest things, and you tend to go to diet, exercise, weight loss. Can you tell us a little bit about the magical things that you're doing to help? At least I love your mentality about this, because you don't necessarily believe that the patient's going to come in and be willing to make these huge radical changes in their diet, exercising. It's good to say that, but are they really going to do it? So what are the things? I had the emeralds come up and just other things, maybe injections, whatever it might be. What are you doing to at least spark this initial weight loss, or, the inspiration of getting someone on a better path physically that way?
Honestly, it kind of goes back to the end result. What does the individual really want? Kind of look at it where, hey, look, I'm having, a lot of chronic aches and pains. My knees really hurt, and that's the reason why they're coming in. But the question is, how do you get there where your knees stop hurting so much? And so that's kind of where it comes into like the diet, the weight loss, and those kinds of things. I always try to just start out with some more basic changes. So sometimes it's a matter of just cutting out some simple things. It doesn't have to be every single little thing that they're cutting out, but if they cut out, so for instance, like gluten, or cut out dairy, or probably the most easiest thing to cut out is sugar. It's just anything that's sugar laden. Just cutting out that and starting off with something like that can make like a huge difference. We try to tell people to do, stop everything and just eat like grass and like sticks and rocks. Nobody's going to do that, because sometimes that's how strong that can be. But it's nothing. It's also telling people, hey, look, maybe you want to increase your protein intake. You eat some more protein that help with the muscle mass, number one, which will inevitably, if you start exercising, will help with stability of those joints. But at the same time, that'll help curb your appetite too as well. There's certain supplements also that can help with just appetite suppressants. So sometimes just changing a little bit with supplements and a little bit on the diet to a certain extent. And then we get into like the emerald laser. The emerald laser in of itself does more fat loss than weight loss. Certainly if you lose fat, you lose some weight. Obviously it can also be used for the arms and thighs and the legs. But one of the reasons why I also like it too as well is that you're getting rid of some of that excess fat. Some of that can also be inflammatory. So you're just getting rid of some of the inflammation. You're starting to look and feel better at the same time. So at the end of the day, people then become more motivated to make more changes. So it's kind of more like a springboard for everybody.